Hi, I'm Dr. Tracy Marks, and I make mental health education videos. Today, I'm answering a viewer question about how long does rapid cycling bipolar disorder episodes last. I'm also going to talk about the concept of switching versus cycling. Here's an excerpt of the question. I've been mania-free for nearly 5 months now, when for the last 5 years, I have been rapid cycling with mania or hypomania every month. My husband remembers a psychiatrist telling us that rapid cycling usually stops after some time on its own and that it can't last forever. Is that true in your experience? We're really hoping this is the end of my rapid cycling. An episode a year would be a huge improvement as far as we're concerned. I am having more depression than usual. I also wonder if bipolar can sort of just turn into depression. I have been taking herbal antidepressants to help counteract it with some success. They didn't trigger mania either. Thanks for these questions. I've talked in detail about rapid cycling bipolar disorder in this video. But to remind you, bipolar disorder is considered to be in a rapid cycling state if you have more than 4 episodes of either depression or mania in 1 year. And this could look like having episodes of depression that lasts a month or two, and then you feel well for a few weeks or even a few months, and then you get depressed again, and maybe that lasts for a few weeks before it goes away. And this can happen whether or not you are on medication. If you are on medication, we would call it breakthrough episodes. You broke through the protection of the medication with an episode. The viewer said that they had episodes every month. Monthly frequency is called ultra-rapid cycling. As for how long this lasts, there's not a lot of studies on this, but a 2003 article that I have referenced in the description said that 80% of people stopped rapid cycling after 2 years. They and other researchers also saw that people who rapid cycle tend to spend more time depressed, just like the viewer said. So it's not as though bipolar disorder just turns into depression. It's more that you can have more depressive episodes that last a long time, like months. Being depressed for a while can make you want to take an antidepressant to deal with the depressive episodes, but antidepressants can trigger cycling as well as trigger mixed episodes where you have a mixture of depression and mania. Antidepressants don't always make it worse, but it can. There are other things that can trigger cycling or keep it going, like using stimulants to treat attention issues. Examples of stimulants are Adderall, Vyvanse, and Ritalin. People can have a combination of bipolar disorder and ADHD, but the bipolar disorder all by itself can mess with your focus and attention, and I compare the two conditions in this video. If you do have both, like you were diagnosed with ADHD as a child before you started having depression and mania, you pretty much have to prioritize which disorder you're going to focus on. In most cases, the symptoms of bipolar disorder take priority over the ADHD, and you have to focus on treating your bipolar illness and hope that it helps with your attention. Most people with bipolar disorder cannot tolerate taking stimulants. And this is especially the case if you have bipolar 1, where you have manic episodes. The stimulants make you unstable by triggering rapid cycling, mixed episodes, and in some cases can make you psychotic, where you hallucinate or you have delusions and believe things that aren't true. When you're manic, you're already amped up, so taking the stimulants while manic is like pouring lighter fluid onto a flame, and mentally you can just go off into the stratosphere. Now you may say, I've had bipolar disorder and I've been taking stimulants with no problems. And I say, good for you, everyone's different. But there's a lot of people who think they have bipolar disorder because they've been repeatedly depressed and angry. When I talk to people in a consultation and try to figure out their diagnosis, one of the first things that I ask them is to describe their manic or hypomanic episodes. If you've been living with bipolar disorder for years, you ought to be able to describe your mania. Sometimes the answer is, I can't describe it. I just know I feel really good sometimes, and then there's other times that I'm depressed. Well, mania is more than feeling good. And when you live in a depressed state most of the time, feeling good can feel so foreign that you can mistake it for mania. But I digress. If you're struggling to understand what bipolar disorder really looks like, you can watch my bipolar disorders playlist, or you can get my new guide called Bipolar Basics: Unpacking the Nuances and Understanding Solutions. It's a written compilation of my videos. It's nicely laid out with illustrations and arranged in an order that helps you understand how to recognize bipolar disorder and helps you understand different treatments, including non-medication treatments. This will help you put your symptoms into words so that you can have better conversations about your experience with your family, friends, doctor, or therapist. You can reserve a copy of the Kindle version on Amazon. It releases for publication on July 1st, at which time you can also get the print version if you prefer physical books. And you could get the EPUB version if you like ebooks, but you're not a Kindle user. So back to rapid cycling. There are other triggers for it, like steroids, possibly low thyroid, having a head injury, and here's one, circadian rhythm changes, like traveling and crossing time zones. In general, people with bipolar disorder are very sensitive to body clock disruption. So traveling time zones is one way to disrupt your body rhythm, but shift work or just pulling all-nighters or nearly all-nighters are other ways that you can disrupt your body rhythm and keep rapid cycling going. So look out for these factors in your life if you are cycling. What do you do about the depression if antidepressants make things worse? One option is bright light therapy. I talk about it in one of my bipolar disorder playlist videos, but I also talk about it in the guide. One last concept that I want you to know about is the issue of switching versus cycling. The usual course of bipolar disorder is you have an episode, you recover from it, then you have another episode at some time in the future, and that episode can be the same as the previous one or the opposite pole. Many times people will use the terms switching and cycling synonymously, but switching is really different from cycling. Switching refers to the direct transition from one pole to the other pole. So you can have depression, and as that episode resolves, you go straight into mania. It can happen the other way as well. You can have mania that transitions straight down into depression. And there's no break in between the episodes. Early researchers called this circular insanity. There's two versions of it. There's the situation where you always have a pairing of the two poles. So let's say you have depression that's followed by mania, then that resolves, then you go several months or even years before you have that pattern return of depression followed by mania. Then there's a continuously circular variety where you keep switching from one pole to the next. I don't know how common it is to really do that. In 20 years, I have never seen someone continuously switch back and forth. In fact, most of my patients who stay on medications have very few episodes. Or they may be the person who stays in a low mood state for a long time. They may not be all the way depressed, but they're not back to their usual state either. And in my experience, people who truly switch from one pole directly to the other were harder to manage and usually required more frequent medication changes. And sometimes there was a medical issue causing the switching as well. So the takeaway here is that rapid cycling of your moods is usually limited to a couple of years or less. It's often triggered by something, so if you are cycling, you and your doctor need to look to see if you can find something that may be aggravating your stability. That could be a medication that you're taking for some other disorder, like prednisone for a prednisone taper that you could be put on for an asthma attack. And then lastly, polarity switching is another sign of instability and may call for more aggressive medication management, like maybe needing to be on more than one mood stabilizer. Check out these other videos, one here on bright light therapy for bipolar depression, and this other one on when you may need more than one mood stabilizer. See you next time.